So good morning, everybody. I'm Annie Dean. I co-founded Kabuki Syndrome Foundation with Jill Oram Dunbar and Pat Dunbar. I remember when Jill and I had our first conversation in a small WeWork office back in 2016, and it has just been so invigorating and exciting to see the progress that we've been able to make over the course of the past several years. We have been so fortunate to pick up amazing board members along the way, like Leila and Ed Ozania, Tom Singari, and our incredible executive director, Janet Lee. And I wanted to make sure that I could share my thanks with them as we start off this session. In my day-to-day life, I'm an attorney and an entrepreneur. I'm currently the director of remote work at Facebook, and that makes me even more impressed at Janet and others who've been able to pull off this incredible global virtual event. So thank you again. And most importantly, I am a mother to Walter Zaitsev, Walty, who's 6 years old, has Kabuki syndrome, and is the absolute love of my life. In this segment, we're going to be talking about the role of the patient in discovery and patient research. I know that's an incredibly important thing to those of you in this community who are joining today and are looking for ways to make sure that your voice is represented in the priorities of researchers, clinicians, the medical, scientific, and drug development communities. Our goal is to make sure that the impact of research delivers value to you and to your family, and to make sure that what matters to you is at the center of the global efforts surrounding Kabuki syndrome. So here's what we're doing at the foundation to make sure that your voice, the patient voice, is at the center of global research and drug development efforts. We consider this sort of a cycle, and I'm going to walk through that cycle process and share how we're building each of the steps. First, we're building a community of researchers, clinicians, and patients, and we are deeply invested in breaking down silos across that community to make sure that efforts are truly collaborative, that information can be shared, and therefore that value is achieved across those different partners in a more sustainable and meaningful way. We're turning to each of you to directly ask you what matters to you in order to identify and prioritize research. We call this crowdsourcing, and this is actually going to be the subject of the next session after this one that will be led by Jill Oram Dunbar and Amanda Gamboa. After we identify research in collaboration with you, our goal is to find researchers to actually do the research. And we're able to do that through a community that we've been cultivating. And hopefully you see evidence of the community, the research community that we've been able to engage through the incredible speakers that you see at this conference today. Next, we fundraise to conduct the research. And I know there'll be an update shared before lunch, but we continue to see that fundraising ticker climb higher and higher during this conference and over the past couple of days. So if you're interested in donating, please do go to kabukisyndromefoundation.org and contribute. Finally, we recognize that patient data itself is an asset, and we want to make sure that that asset is treated as an asset and that we are able to leverage that asset in the drug development process in exchange for acceleration of the priorities that matter to you and to all of us. And then finally, I just want to share that as we think about that final stage where we've gone from, we have this great community, we've been able to identify the research priorities that matter to the community, we have research in place, we're conducting the research because we've got the money. Well, the last step is to actually conduct a clinical trial. And that requires an enormous amount of patient involvement, everything from designing the research to designing the trial to understanding what downstream impacts might be and advising our key opinion leaders in those areas. And then it also, of course, includes things like patient recruitment to make sure that we have enough patients in those clinical trials. So again, the patient community is really at the center of our ability to drive forward research, treatments, and maybe one day a cure for Kabuki syndrome. Dr. Simpson has been a wonderful collaborator to KSF and has provided us guidance in multiple areas. I know we're always so grateful to have her views, especially as we develop programs like the creation of clinical centers of excellence, part of our key strategy. So finally, I'll introduce Dr. Simpson's session called Sharing Stories and Improving Science, How the Patient Experience Shapes Research and Endeavors. Thank you so much for being with us today.
Hello, everyone. It's a pleasure to be here. Thank you for allowing me to speak. As Annie has said, my name is Brittany Simpson, and I am a clinician and clinical geneticist in Cincinnati. I would just first off like to kind of go through kind of how the evidence is used within both clinical endeavors as well as research, and then also just a little bit more about research. But really, truly at the center of everything should be our individuals and families, as this is they are the true experts when it comes to are these very rare disorders. And so first off, as I said, I just kind of wanted to introduce you guys to how medical students are introduced to this evidence-based practice and things that we try as doctors to do to provide the best care. And so you start off by formulating a question and you track down that evidence. You go into, Google Scholar or PubMed and just really look to see where is the validity, where's the usefulness, and can I apply this to this patients? And then you do apply those, and then you evaluate it. But really, in rare disease, unfortunately, we are dealing with populations of individuals who are low in number, which makes statistics a little bit more difficult. And so we really can't efficiently track down the evidence. Therefore, we can't really go through that practice. And that's really what we are driving to change about these rare disorders. And so that evidence is gained through usually the traditional research approach, and so which has been very great in moving the science forward, but has been quite slow. And so this is just kind of a schematic that shows that, we have these clinician scientists or these researchers who are working independently, kind of like parallel play. So we all have gone through our developmental milestones, and one of those milestones is parallel play, where, you're kind of sitting there playing beside someone, but not necessarily with someone. And so the clinicians are maybe over time, they see 10 patients and they're like, wow, my patients really have struggled with this one particular challenge. So how can I best investigate that challenge? And really they undertake the study, which takes some time, and then they have their findings. And that is going on simultaneously throughout the globe. But really at the end of the day, what we're questioning is are the findings truly meaningful? Are they actually impacting our patients and families' lives? Are they impacting the research to drive the disease forward? And that's really why we are advocating now within many of the rare disease communities for this patient first approach, which quite frankly should have been going on the whole time, but that's neither here nor there. And so really with this approach, you have these clinician scientists and these researchers who are wanting to, ask questions and provide the best care, but the patient is at the center of these endeavors. And so not only are the clinicians and the researchers working with the patients, but the patients are helping to create this good collaborative environment to link the physicians and the researchers together to really empower the entire approach. And so with this patient-centered endeavor, you really get these patient-driven questions that then can efficiently be answered through studies of different approaches. And then really what we want it to lead to is valuable findings for patient outcomes and for disease pathology. And so what's the big deal? I've kind of alluded to some of this a little bit before, but first and foremost, the big deal is just taking better care of our patients. But really for our patients, what is important for you? What are the things that are most impactful to your lives? What challenges have been the most difficult to overcome? And how can we approach the question to really find out a better way to answer that? And so and inevitably we want to improve those patient-centered outcomes. And again, given that we are within a population that is smaller, say, than heart disease, which impacts like almost everyone, we really are able to come together and give that power to the research that we need. Also, we do live in a world where money and funding is important. If you don't have the funding, you're not able to do your work. And so really allowing this big, great community of scientists to come together with those patient chosen questions really allows us to streamline these efforts. So we really want to maximize our output for every dollar of funding. It would really help to also not duplicate efforts, and really also being able to choose the researcher at the best, who has the best skill set to answer that question. And as I've alluded to, we really want to be able to utilize all this information to establish good guidelines for proactive rather than reactive care. And so I say this all the time to my families, the point of genetic testing is to identify what may be the cause for the differences that we see, but it's really so that then we can move forward with that personalized care to make sure we are preventing things that we can, and really staying on the forefront of things and not really trying to catch up. And so in that same vein, with providing better care and providing better outcomes, we also want to be able to utilize this patient-centered approach for clinical trial development. It's kind of sad, but actually 30% of phase 3 trials never become completed because of enrollment problems, which I know everyone has their own opinion and their own comfort level in participating, which is absolutely fine. It's your choice. But not only with the completion of clinical trials, but actually the development is very important to have patients involved. There have been clinical trials in rare disease that haven't shown a difference, and it's probably because the trial design was not optimal. They may not have really been looking at the thing they needed to see the difference. And that's where you guys come in and really help empower that research. But additionally, I know many of you probably heard the whole adage of rare disease and the mascot mostly being the zebra. And so really that kind of comes from in our medical school training, we're told, if you hear hooves, think horses, because that's the most common thing. But we know not every hoofbeat is a horse, and sometimes we have those zebras. And so when those zebras come together, yes, alone they may be rare, but together they are strong. And not only that, sometimes we have rainbow zebras who just come in and are bright, shining wonderfulness, but they do have things that are more rare in the population even. So coming together to really assess that is important. And not only that, but coming together in a group with other disorders that have more commonalities can also really help drive disease understanding forward. And so I know one of the questions was, what do you mean by that mechanism of disease? And so we know that in Kabuki syndrome, that machine that's going in to try and open the book and read it for our instruction manual is a little not as efficient. And so that kind of difficulty with opening the book is seen in other disorders, kind of like the previous talks discussed about Rubinstein-Taybi. And so we really can also come together as a community to help move the science forward for both disorders, because when you have mutual interests, you get mutual gains. And I know I've kind of alluded to this a bit, but we really want to build that strong community. And, you guys are so wonderful with building together and coming together, especially with the connectivity of our world. But we also want to make sure that the entire community is able to work together. So individuals, families, clinicians, and research, because we all have the same goal in mind. We want to take better care of our patients. And so with that in mind, I just wanted to share a little bit about the work being done here in Cincinnati through this patient-driven research approach. And you're also going to hear about a real-world example by Dr. Serrano next within the community and how it can be done in practice. And so like I said before, I'm the director of the Epigenetic Syndromes Clinic, and we are new. We were founded last August, but we would like to provide that comprehensive interdisciplinary care based on the needs of our patients and families. And so, one of the things I always make an effort to ask is what what is the most challenging part of your life right now? What are the things that are most challenging, so that we can then direct kind of care that way. We also are working with others with the building of a consortium with the natural history study, and then also with translational research within the community. And ultimately, always, we want to improve outcomes through patient-driven research and through our clinical trial endeavors. And so here is our lovely team. So Dr. Brightman is a genetic counselor who actually received she did her PhD work within the Kabuki world and looking at the KMT2D regulation of the retina. And so she is just a wonderful person who I know some of you have been able to meet, and hopefully others will be able to as well. But we are working together with the clinic. And then Miss Dina is a new addition to our team, and my right-hand man. I really don't know what I'd do without her. So she is our clinical research coordinator, who you might have spoken with through the phone or email, but she joined us in July. And then also, as I said, we're new and we're building. And so right now, our specialists that work with us are Dr. Susan Wiley, who is just a phenomenal developmental behavioral pediatrician, and then Dr. Erin Kellner in allergy and immunology. She actually took over for the clinical care for many of the patients here in Cincinnati after Dr. Andrew Lindsley went on to another opportunity. However, he is still actively involved and has continued interest in helping patients within the Kabuki syndrome community. And so just to kind of highlight a little bit, we've got the natural history study of Kabuki syndrome and the biorepository. As many people have alluded to already, and you're going to continue to hear, we really have got to understand the challenges that our patients face in order to truly understand the natural trajectory. Because if we don't, we're not going to be able to assess if our medications that we try actually improve anything. And that is at the end of the day what we want to be able to do. We also have a biorepository, which just means that we have a place that we can store samples that are very, very valuable. Most of the time it's, things that would be otherwise thrown away. And so we get to just keep those for future studies. And this schematic on the right-hand side just kind of shows it's not that important, just the overarching organization where we're trying to utilize the connectivity of our world to really empower both the clinical and the research side of things. And so as far as our translational work goes, we do have a couple of studies utilizing pluripotent stem cells, which it's so very neat. You can take just a simple blood sample and then turn it into any kind of cell you want, basically. And so right now we've got KMT2D, so Kabuki syndrome type 1 and Kabuki syndrome type 2 with the KDM6A, where we have made those machines less efficient, just like we see in our patients, where in the neural crest cells. And so these little cells are really important. They kind of form in one little spot along the baby's spine when they're in utero. And then they march off and do tons of very important things. And so we think that part of the, or several of the things that we see for our patients, those challenges that they have, may be coming from the fact that these little guys, these neural crest cells, are not functioning the exact way that they should. And so that are things like the heart and divide, when the heart is forming, obviously you have to have that septum to kind of divide the heart, and some of your kiddos may have had a hole in their heart or something, and this could be the cause of that. But not only that, our gut is very much regulated through these cells, and so I'm not sure if your loved ones have had issues with constipation and reflux, all those good things. So there are a lot of different things we can utilize with these cells, so we're trying to get that cell line going to perform more studies, and those are growing and dividing as we speak. And then we also would like to then take those cells where we've changed that misspelling in one of these machines to make it more efficient, and then correct it with the CRISPR-Cas9 system to assess if we can really see a rescue, is how we kind of call it, basically reversal of what we did. And then also within Kabuki syndrome type 2, as I'm sure many of you are aware, that is actually an X-linked syndrome, meaning that it's on the X chromosome. Females have 2 X chromosomes, male have 1 X chromosome. And so we want to just see how that impacts the function within these stem cell lines. And then also, as a future direction, we know that the impacts to the nervous system are extremely important for our families and our individuals with Kabuki syndrome. And so we really want to move toward more of neuronal progenitor cells as well. And we have the ability to make these brain organoids, which basically is a brain in a dish. And so being able to really study some of the architecture from human cells can also empower a lot of the mouse and animal model work, as there are inherent differences, as you can imagine, between a human cell and a mouse cell. And again, just kind of utilizing all of this together within the community to really drive forward the research. So anyway, I just want to thank you again for having me today. And please, if anybody has any questions that you do not want to ask over the platform, you can feel free to email us at either epigenetics@cchnc, or that's my personal email. And then I'll be happy to take questions at the end. Thanks.